My topic for presentation today is on the recent advances in the treatment of fungal keratitis. Fungal keratitis is the most elusive type of corneal infection related to bacterial and viral keratitis and is associated worldwide with significant ocular morbidity, including ocular opacity, and may cause blindness. If treated well and quickly, it can severely reduce the ocular morbidity. In the past few decades, several new antifungal agents have been developed with improved efficacy, and considerable research is being conducted in the field of management of fungal keratitis, and several newer antifungal agents and drug delivery techniques are being evolved to overcome these limitations and improve outcome. Polyenes are the two major classes of antifungal drugs used to treat ocular fungal infection, including fungal keratitis. Amphotericin B has poor ocular penetration after intravenous administration and is toxic to human cells at a higher dose. In a study conducted by Murad et al., compared the commercial 0.15% amphotericin B with the liposomal formulation and found that the liposomal form was more stable and less toxic, and also increased the potential amount of loaded drug by threefold compared with the conventional form. Posaconazole was either used systemically alone or in combination with topical posaconazole suspension in these studies, and it resulted in rapid resolution of infection in some cases without significant toxicity. It can be thus assumed that posaconazole can be used in cases of mycotic keratitis that are resistant to standard antifungal therapy, and the use of topical posaconazole alone without use of oral preparation needs to be investigated further. Evidence on its use in ocular infections is still limited, but initial results are encouraging. Sponsor et al. Also described a case of keratitis by Fusarium solani resistant to amphotericin B and natamycin, but successfully treated with topical drop associated with oral posaconazole. Comparative control studies with first-line antifungal drugs are still lacking. Alton et al. Reported successful treatment with posaconazole in 2 cases with recalcitrant fungal keratitis that were resistant to conventional antifungal drugs. Echinocandins are a group of newer antifungals which comprise of capsifungin, micafungin, and anidulafungin. Matsumoto et al. Have reported successful use of topical 0.2% micafungin in cases of refractive fungal keratitis, and in another study using topical micafungin 1 mg per ml reported found an efficacy comparable or superior to fluconazole in the treatment of keratitis by Candida albicans and Candida parapsilosis. Topical caspofungin has been used in the cases of fungal keratitis refractory to voriconazole, but still limited data on the use of echinocandins to treat fungal keratitis in humans. There is need for clinical studies with adequate sample sizes to validate the safety and efficacy of these group of antifungals. Advances in the surgical management include intrastromal injections, collagen cross-linking, rose bengal aided photodynamic therapy. Intrastromal method of drug delivery overcomes a major limitation of topical antifungal therapy, which is poor bioavailability of drugs in case of deep-seated fungal corneal ulcer, providing a depot of drug close to the ulcerated area at a dose of 50 microgram per 0.1 ml in 5 divided doses, from where the drug is slowly released into the infected tissue. Various studies in the literature have found that targeted therapy with voriconazole as an effective approach for deep-seated recalcitrant fungal corneal infections not responding to conventional treatment modalities. It has also been effective in managing secondary lamellar interface infection for late onset infectious keratitis after DSEC, acrimonium fungal keratitis, and post-PRK keratectomy fungal keratitis. A study done by Sharma et al. Found no benefit of intrastromal injections over topical voriconazole in recalcitrant fungal keratitis cases not responding to topical natamycin therapy for 2 weeks in cases of moderate fungal keratitis. Similarly, Nikki et al. Found intrastromal voriconazole to be successful in treating keratitis due to yeast only, but not keratitis due to filamentous fungi, which is in complete contrast to the experimental study results. Intracameral amphotericin B is another targeted drug delivery system indicated with medical therapy with topical and systemic antifungal has failed, especially in cases with deep mycosis, endothelial plaque, and presence of hypopion and or inflammation of the anterior chamber. Concentrated injected, as described in literature, ranges between 5 and 10 microgram per 0.1 ml. Amniotic membrane transplantation has emerged as an option to delay or prevent penetrating keratoplasty secondary to fungal keratitis. It can facilitate ocular surface reconstructions in other ocular surface conditions and supports the reepithelialization of tissue and active components present in the membrane, like nerve growth factors, are thought to reduce pain. In a study, 23 culture-proven acute fungal keratitis patients with non-healing corneal ulcers or impending corneal perforation underwent AMT, out of which 25% of the patients with persistent positive culture for fungus required penetrating keratoplasty, and the visual outcome improved in 17, did not change in 4 patients, and worsened in 2 patients. In a study done by Prajna et al., the extended release kinetics of voriconazole from the impregnated human amniotic membrane was evaluated, and the ham buttons were incubated with freshly prepared 1% topical ophthalmic formulation of voriconazole for 5 different exposure time to investigate the ideal exposure time. The drug release kinetics was studied in simulated tear fluid for 5 weeks, and the amount of voriconazole released at different intervals was estimated using high performance liquid chromatography with photodiode array detector. They concluded that the sustained release of voriconazole was achieved up to 5 weeks when voriconazole was incubated with amniotic membrane for all the studied drug soaking times. Voriconazole, thus impregnated amniotic membrane, can be considered for the sustained delivery in fungal keratitis. Lamella keratoplasty has also emerged as an alternative surgical procedure for fungal keratitis, in which only the disease layer of the corneal surface are excised and replaced by donor cornea. In a study done by from China, reported the leading indication for lamella keratoplasty in 2008 was infectious keratitis, and fungal keratitis constituted 67% of the infectious keratitis cases. And another study, 55 antifungal refractory patients underwent lamella keratoplasty with intensive topical and oral antifungal medication, and out of which 93% of the patients, the fungal infection was eradicated, and the remaining 4 patients were treated by a secondary penetrating keratoplasty. Rose Bengal photodynamic therapy. Photodynamic therapy involves the activation of photosensitizers using light of varying wavelengths. In an experimental study, Arboleda et al. Have demonstrated Rose Bengal PDT to be successful in infectious keratitis, but still there are no clinical studies to date to justify PDT with Rose Bengal for the treatment of fungal keratitis. Ameskova G et al. In an in vitro and in a case study evaluated the efficacy of Rose Bengal photodynamic antimicrobial therapy and found that riboflavin CXL demonstrated no inhibition of fungal isolate growth, whereas Rose Bengal PDAT inhibited fungal isolate growth within the irradiation zone. In addition, a case with this resistant Fusarium keratitis was treated successfully. New targets in immunology involved the role of vitamin D receptor in innate immunity being discovered may be a new target of treatment that can be explored for fungal keratitis. Liposomes encapsulated menin extracts from Candida albicans stimulate the production of antibodies protective against candidiasis in mice. These experimental studies may further facilitate researchers to develop fungal keratitis vaccine and the use of probiotics in ocular surface for diseases prevention. Recently, many efforts have been made to improve topical ocular drug delivery by designing various novel drug delivery systems, including liposomes, nanoparticles, nanoemulsions, nanosuspensions, micelles, nanofibers, etc. Several studies have reported encouraging results with novel drug delivery systems. In a study, the liposomal formulation of antifungal drug voriconazole found to exhibit a sustained drug release profile and an 8-fold increase in the amount of drug retained in the cornea after 1 hour of exposure compared with the conventional suspension formulation. The nanoparticle formulation of amphotericin B showed a sustained and controlled drug release for up to 11 hours, while the conventional drug formulation released the entire drug in only 4 hours. Nanoparticle formation was also shown better pharmacokinetic properties, including 1.5-fold increase in half-life compared to the conventional solution formulation. It also showed that the microemulsion formulations of fluconazole showed a controlled release profile, releasing 50 to 80% of the drug in 12 hours compared to the conventional drug solution, which released almost the entire drug in the first 6 hours. In a experimental study done by Jane et al., the study used cultural corneal epithelial cells reported enhancing penetrability of formation of the prepared formula particles release the drug for 12 days. Antimicrobial peptides have significant potential for use as antimicrobial agents for ocular and other infections. These are also known as host defense peptides. They are present on the surfaces of the eyes and in tears. More than 500 antimicrobial peptides have been reported. These natural antimicrobial agents act by several different mechanisms of action, such as forming pores in bacterial membranes, resulting in cell death, preventing attachment, blocking entry, chelating ion, and digestion of bacterial and possibly fungal cell walls by lysozyme. View et al. Evaluated the application of synthetic beta sheet forming peptide and IC354-Topic for in vivo fungal keratitis treatment in comparison and amphotericin B, and found that topical solutions of their designed peptides were safe and effective as the clinical used amphotericin B. The authors also concluded that the synthetic beta sheet forming peptides are promising candidates for the treatment of fungal keratitis. Iontophoresis is a method used to enhance penetration of drugs into the skin by application using the low intensity electric current. Recently, Calc and Zeke and co-workers investigated voriconazole penetration and antifungal potential in the fungal keratitis model assisted by iontophoresis. The results showed that the iontophoresis assisted group demonstrated the better antifungal activity against the experimental strains Fusarium solani keratitis for log reduction and Candida albicans keratitis combined with the native drug followed by topical ocular application. Further, voriconazole levels were also found to be the highest in corneal tissue in animal groups received iontophoretic treatment. Thank you.